Dr.Sanguan, his untimely death on the 18th of January 2008 was met with tremendous sadness and disbelief among people both inside and outside public health circles. And became news in various kinds of Thai media, such as television and radio, and making newspapers headline. His friends, health and social activists, expressed that Thailand owed Dr.Sanguan a great debt for his nearly 3-decade struggle to create universal health care. This has been considered as his legacy that has created an important momentum for the Thai society to improve health and social services and reduce economic inequalities throughout the country. Moreover, his contributions have not limited only to the Thai society. He had also participated to a lot of international activities, especially to international academic community. Being an active member of the Dragon Net could be one of good examples of his international contributions and participations. He had created a number of collaborative projects and activities with a lot of international partners, both at institutional and individual levels, such as WHO, ILO, EU, London School of Hygiene and Tropical Medicine, University of Edinburgh in Scotland, Institute of Tropical Medicine, Antwerp in Belgium, and etc. Through these long-term collaborations, new knowledge could be generated as significant inputs to facilitate and stimulate a reform of the Thai healthcare system. In 1989, 12 years before achieving universal coverage, a collaborative process started by developing a model of integrated healthcare in one province. Then, during 1992 to 1996, this model attracted demand from other provinces to follow. From 1996 to 2000, developed, first, a package of policy and plan for overall healthcare reform. Second, a model of appropriate healthcare in various provinces. And third, a drafted legislation on universal coverage of healthcare for all Thai citizens. In 2001, products were adopted by the government to start the implementation of universal coverage policy. Since then, Thailand has achieved universal coverage of health care. Along with this long process, both before and after achieving universal coverage, Dr. Sanguan had created a lot of collaborations with neighboring countries such as China, Laos, the Philippines, Nepal, Bhutan, and Myanmar. He went to give advices and also invited key actors of those countries who could make visits to Thailand in order to learn from the Thai experience. When his life and career hit its peak, he was diagnosed as having a lung cancer. He mentioned in his book before he passed away, Turning Cancer into Power, about the feeling of that day that it was the day in my life when my heart was full of energy to move, but it was the day when I was told that I had cancer. He defined the way he lived with cancer as active pursuit of life. There is no use giving up on life, as life is worth living if we try to make each day count.